Hello, this is William Jackson, and this is my head to toes assessment. I provided privacy for the patient. I wash my hands, and this is my patient Lisa Davis. Her birthday is 10/28/76. Um, I obtained a set of vitals, and her vitals is within normal range. Patient level of consciousness, she is alert to person, place, and time. Patient has a good posture. Patient is able to ambulate independently without any device. She appears to be in a good mood. Her hygiene, she's very clean and dressed appropriately for the time of day. Patient is able to speak and hear clearly due to her responses to question asked. And throughout the procedure, I'm going to assess the patient's skin for color and temperature and any sores or lesions on her skin. Now I'm going to start with the patient head. I'm going to inspect your head, and her head is round and symmetrical. I'm going to palpate your scalp for any lumps or bumps. Do you feel any pain or tenderness?
No.
There is no pain or tenderness that is noted. Now I'm going to inspect the patient's eyes. Patient eyebrow is evenly distributed. Her eye is round. I'm going to assess her facial features first. I want you to smile for me. Frown. I want you to puff out your cheeks. Patient is able to smile and frown, indicating cranial nerve 7 is intact. Now I'm going to palpate her sinuses. Her maxillary sinuses. Do you feel any tenderness? Her frontal sinuses. There is no tenderness. Her temporal artery. Her TMJ. Can you open your mouth for me? Close. Open your mouth. Close. Move your jaw on the side to side. There is no popping or clicking sound on palpation of her TMJ. Now I'm going to look at the patient's eyes. The patient's eye is round, symmetrical. Her eyebrow is evenly distributed. Her eyelid is smooth. There is no redness. Her eyelashes are evenly distributed to her eye. Now I'm going to test the patient's visual field. I want you to cover your eye and tell me when you see the light. You cover your right eye. I'm going to cover my left.
Yes. 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 Yes.
Okay. Thank you. Patient is able to see. Patient has a good visual field. Now I'm going to check her conjunctiva, and it is white. Her sclera is white with some brown dark spots. Her cornea is smooth and translucent. There is no lesions or redness noted. Her pupil, I'm going to check her pupil. Just stand straight. Don't keep your eyes on me. So her pupils are equal and reactive to light. And accommodation, I want you to look at the pen. Just keep your eyes on the pen. And accommodation is noted. Now I'm going to check the patient light reflex. So patient has a good light reflex, indicating cranial nerve 3, 4, and 6 is intact. Now I'm going to inspect. I'm going to inspect the patient for red light reflex. So I'm going to go to her eyes. I want you to look at me. Okay. I want you to look straight at me. So red light reflex is intact. Now I'm going to inspect the patient. I'm going to inspect the patient ear. Now I'm going to start with her outer ear, and her ear is symmetrical bilaterally. There is no drainage, no redness, and I'm going to palpate her ear. Do you feel any pain or tenderness?
No.
I'm going to palpate her lymph node, a pre-auricular lymph node, post-auricular lymph node. Do you feel any pain or tenderness?
No.
Now I'm going to do the whisper test. I want you to cover your ear and tell me what you hear.
Apple, banana, juice.
Okay. Patient is able to hear, and I will do the same on her left ear. So patient is able to hear through the whisper test. Now I'm going to do the Weber test, and I want you to tell me where you hear, okay?
Both.
Patient is able to hear in both ears. Now I'm going to do the Random test.
No.
I'm going to do that again.
No. No.
So air conduction is twice as long as bone conduction. Now I'm going to inspect the patient. I'm going to use the otoscope to inspect the inside of the patient's ear. So, visible eardrum, there is no redness, there is no drainage to the ear. The eardrum is smooth and gray. Now I'm going to inspect the patient's nose. The patient's nose is made onto her face and is symmetrical bilaterally. There is no drainage, there is no dryness noted to her nose. Now I'm going to inspect the inside of her nose. So her mucosa is smooth and dark in color due to her race. The spectrum is midline, and her turbulence is, there is no redness noted to her turbulence. Now I'm going to inspect the patient mouth. Her mouth is symmetrical. There's no dryness or crack or open area noted to her lips. I'm going to inspect the inside of the patient mouth. I want you to open your mouth. I want you to bite down. So the patient's teeth is clear. Her gum is dark pink. Her gum is dark pink. Her uvula is midline, and her uvula is midline. Her tonsil is 2+ tonsil. Let me check gag reflex. Open your mouth. Your tonsil So gag reflex is present. Gag reflex is present. Now I'm going to check for patency in the patient's nose. Sniff. I want you to sniff again. So her nostril is patent bilaterally. Now I'm going to inspect the patient. Now I want the patient to identify smell. I'm going to give you a thing to smell. I want you to tell me what you smell, okay? Okay, patient is able to identify smell, indicating cranial nerve 1 is intact. Okay, now I'm going to check the patient's neck. I'm going to assess her neck for any jugular vein distension on her neck. There's no jugular vein distension. So I want you to do a clavicle range of motion, okay? So I want you to turn your head side to side and up and down, okay? Okay, go ahead. Okay, down, on the side, on the other side. So patient is able to turn her head side to side, and I'm going to palpate her trachea. So patient trachea is symmetrical bilaterally. Now I'm going to test her. Now I'm going to test her thyroid gland. Now I want you to take your head back. Okay? And I want you to swallow straight for me. Just try to swallow. Okay? I want you to try to swallow. Okay. So patient is able to swallow. Her thyroid gland is intact. Now I'm going to check her carotid artery. Her carotid artery is 2+. Now I'm going to palpate her lymph nodes. And I'm going to start with the pre-auricular lymph node, post-auricular lymph node, occipital, submental, submandibular, jugular, digastric, superficial clavicle, anterior clavicle, posterior clavicle, and deep clavicle. I want you to turn your head. Deep clavicle and supraclavicle. Supraclavicle and inferior clavicle. So there is do you feel any pain or tenderness?
No.
There is no pain or tenderness to her lymph node. Now I'm going to test her muscle strength. Now I'm going to push down on your face, and I want you to try to keep your head. Okay. I want you to push down on my hand. Okay. The other one, push down. And I want you to take your shoulder up, try to push your shoulder up like that. Okay. So patient's sternal strength is intact. Now I'm going to auscultate her carotid artery. So there is no bruise at her carotid artery. There is no bruise on her at her carotid artery. Now I'm going to assess the patient's sternocleidosis. Now I'm going to take an object. I'm going to put an object in your hand, and I want you to close your eyes and tell me what you feel. Okay. Patient is able to identify object in her hand. Now I'm going to draw in your hand. Tell me what I draw. Okay, patient is able to identify object in her hand, indicating her graftiodosis is intact. And now I'm going to stop here and continue the video to the next segment.